Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I'm Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour where we will explore revolutionary expansion of mind, body, and soul. Each time on the Dr. Diane Show, we have experts from around the country discussing cutting-edge topics on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. I'm excited today to have Dr. Jake Berman with me. He is a physical therapist and the owner of Berman Physical Therapy in Naples, Florida, where he focuses on treating the actual problem causing your symptoms and pain to help you avoid taking pain pills and dangerous surgeries. Back pain sufferers are desperate for relief, and they turn to Dr. Jake for one simple reason: results. Dr. Jake's expertise and passion for helping individuals find relief from pain is unparalleled. If you're tired of feeling old and you're looking for another way to keep active and mobile, call Dr. Berman. His number is 239-431-0232 and take advantage of his free 30-minute taster session. So welcome, Dr. Jake. How are you today?
Man, that was a serious intro. Talk about setting the bar high. I hope I can produce now.
Yeah, I know. We're expecting good things from you today.
All right,
So, this is
happy
a
to
great
do so.
topic. This is an awesome topic because I think people have so many misconceptions about back pain, and we're gonna focus on this. But you do a lot of things, related to joint pain, knee pain, shoulder pain, you name it. But the question that everybody probably has is, why are they having chronic back pain? What is the number one cause of chronic back pain, do you think?
Do I think or do I know?
Do you know?
I know what the number one cause of chronic back pain is, and it's actually an epidemic that's been sweeping the nation here lately, and it's called WAS. That's the initials for it. WAS is short for weak ass syndrome.
I love it.
Oh
Yeah.
man.
So people basically are losing strength in their glutes and butt, and that's the cause of it.
Yes, I like to talk to everybody on a fifth grade reading level and keep it as simple as possible because it doesn't do anybody any good if I try to sound smart and use medical terminology and anatomical terminology and all that stuff. When you can't understand it, it makes you feel dumb, makes me feel good, and it's not a win-win situation. So the easiest way to say it is your glutes, your butt muscle, your glutes, they're supposed to be the strongest muscle in your entire body. The problem is we sit on them all damn day and they get weak and weak and weaker as we get older. And the glutes are the ones that are supposed to support your back because your glutes are in your hips. The next level up is your spine. So if your glutes are not doing the job they're supposed to be doing, the next level up has to do more work than it was ever designed to do. And that's ultimately the cause of back pain.
Yeah, it's so interesting because I think most people would think, oh, it's probably from an injury, like I played sports all my life, or I was a runner, or even silly stuff like you just do something around the house and you pull your back out or whatever it might be. And people are thinking that they did something like, and that's why they have this chronic back pain. But you're saying it's more related to the issue that as we age, we're losing muscle mass and strength, and that's what starts to cause the pain that becomes chronic.
Yes, and I'm so glad that you brought it up because I hear it so many times. I was an athlete. I played football. I was a runner. I've run 1,738 marathons in the past year. Whatever it is, it seems like we always come up with these excuses, and it's I've kind of termed it as an egotistical victim mindset, where your ego is saying that I'm having this pain right now because I was such an amazing athlete in the day, but it's not my fault. I have to live with this back pain because I was such. So that's the victim mindset. The second half is the victim, and it comes after because I was such an amazing athlete, because I abused my body, and it's just not the case. The brutal reality of it is that you have some joints in your body that are just overworked and underpaid. They're getting inflamed. That inflammatory response is creating a pain response. And then you go to the doctor and they take x-rays and MRIs and they say, oh, there's your problem. Herniated disc, bulging disc, degenerated disc, whatever it is. Now we're saying, okay, that's the problem. And it's just not the case. It's WAS, it's weak ass syndrome.
Well, I agree with you because how many people do you know? Well, I'm sure you know tons. I know a bunch of people who have had some type of back surgery or knee replacement or whatever the orthopedic, medical, traditional medical community decided that was the way to go. And guess what? They're still in pain. So that didn't fix it.
Oh my goodness. I see this at least on a weekly basis, if not a daily basis, where somebody has a level fuse. So let's say the X-ray and the MRI say that L3, 4 is horrible. I have to have surgery. So they go and they have a discectomy. And okay, fix the problem. The disc is gone. We cut that thing out. So that's not the problem anymore. And they feel good for 3 months or 18 months, or maybe just a hair and not ever really good at all. And then the next surgery comes up and that creates a fusion, L3-4 fusion. Okay, now I don't have any pain anymore. But because we just fused L3 and 4 and we never addressed the reason why there was an increased amount of stress on that section of the spine to begin with, now the level above and below the fusion starts to get overworked and underpaid. And then guess what? The surgeon said that it was going to happen, that ultimately you'd be back for another surgery for above or below, because that's just the natural occurring process because you have a bad back. You are dealt these cards and you have a bad back. It's like, what? Are you freaking kidding me?
Yeah. And then it's a vicious cycle, right? The next surgery, still in pain, the next surgery. So what you do basically is offer people an alternative. I mean, you're teaching, I love what you're doing is that you've really you figured out what the root cause is and you're not putting a band-aid on it, like traditional medicine does most of the time. But people are probably going to say, okay, so if I strengthen my glute muscles, is it really possible to eliminate back pain for good?
That's the question.
Yeah. Is it
Okay.
possible?
I love it. It's a great question. I cannot tell you how many clients I've worked with over the years with chronic back pain. I'm talking 20 plus years of back pain, and they've just been told that there's nothing you're going to do about it. It's something that you're going to have to live with because your x-ray says this, because your MRI says this, because your mom had a bad back, whatever it is. Then all of a sudden they end up in my office for whatever reason, and they always ask me, do you want to see my x-ray or MRI? And I say, absolutely not. I want to see you. I want to know what your body is telling me. And if I can't figure out what your body is telling me, then I'll consult or compare it or analyze the x-ray or MRI and see if I can make sense of it. And I can honestly say that 99% of the time, I can figure it out. And it's not because the expert in back pain, it's because I'm actually taking the time to put my hands on you, put my hands and assess what is the body saying right now. I don't really care what you are telling me explicitly, meaning that that hurts, it doesn't hurt. I mean, that's a little part of it. I care more about what your muscles are saying. When I put you in this certain position and I test your muscle strength, does it A, turn on? Okay, it turns on. B, is it strong? Yeah, it's strong. C, does it have endurance? Yeah, it has endurance. Okay, so there's no problem there. Then I go to the next section. Oh, crap. it doesn't even turn on. So if it doesn't turn on, it can't have strength or endurance. So here's a problem right here. So I start taking these people who have chronic back pain and breaking it down to a fifth grade reading level. My first mentor was one of the greatest mentors I ever had, Bob Seaton. He's out of Destin, Florida. And I did my last internship with him and ultimately forced him to hire me for my first job because he just blew my mind compared to any of my other teachers or clinical instructors that I had along the way. And this is one of the first things that he told me. He goes, Jake, you're not going to know how to fix everything. But if you go back to the basics, it'll be really hard for you to really screw it up. And you'll eventually figure it out. And he goes, if something is weak, make it stronger. If something doesn't move enough, make it move. Meaning, like if a joint's stuck, get the joint moving again. If something hurts, make it not hurt. Soft tissue massage, right? Decrease the inflammation. So if you just follow those three basic things, you're gonna follow what the body wants, or you're gonna go down the road of what the body wants. And that's what I do with people who have chronic back pain is, okay, I get it. Your X-ray and your MRI are horrible. But let's see what's going on in your butt, right? Let's go test the glutes. Let's test the hip external rotators. Let's test your core, specifically the individual muscles that make up your core. Nobody ever thinks about obliques. They just think about your rectus abdominis, which is your vanity muscle. Doesn't really do a whole lot to stabilize you with bending, lifting, twisting, or triplanar movements like the golf swing. So it's like, what are the obliques doing? What are the glutes doing? What are the hip external rotators doing? And let's make sure they're all doing what they're supposed to be doing. Then let's assess what happens with the back pain.
Yeah, so it's so interesting listening to you, and we're gonna have to go to break in just a minute or so. But when we come back, I want to talk a little bit about your background because I feel like, when I met you, I was like, wow, this guy is not the standard typical physical therapist. I mean, normally you go to physical therapy and all they do is basically what the prescription that the orthopedic doc or whoever you've been referred to is telling them to do, and that's all they're going to do. Whereas with you, um, you don't work that way at all. You're like exactly like what you just explained in terms of like how you feel the person's body and the way they move and these different tests and things like that that you're doing with them. So it's just fascinating to me how different your perspective is, and maybe somewhat due to your mentor and just things that you experienced along the way in terms of how you became the physical therapist that you are. So I definitely want to, when we come back from break, I want to touch on that and just have you tell us a little bit just about, like, how did you come to be that type of physical therapist? Because I think people are very intrigued by you.
Love it. Happy to do it.
Cool, cool. So you are listening to the Dr. Diane Show with me, Dr. Diane Hayden. We're going to take a quick break now. When we come back, we'll be exploring more with Dr. Jake Berman. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. But before we continue, I want to make sure everyone knows how to contact me. You can find me at www.drdianehayden.com or at either of my two publications, www.essentialnaples.com and www.naturalnutmeg.com. And you can learn more about Dr. Jake Berman at his website, which is www.bermanpt.com. That's spelled Berman. P as in Paul, T as in Tom.com. So welcome back, Dr. Jake. When we were right before the last break, we were just talking a little bit about your background and how I was saying how when I first met you, like how it struck me that you were so very different from any other physical therapist that I ever, been to or just met or talked to. So how did that happen? Like you go through the traditional PT school like everybody else does, but you came out with or something happened along the way that kind of shifted your mindset about how you were going to, practice it.
I love it. Absolutely love it. And I've never been a really great rule follower. I've never been very good at authority or following directions, respectfully, right? So when
Right.
somebody asks me to do something, I always have to question it. So this leads me to where I'm going to answer your question. My last boss, who ultimately was one of the greatest mentors I ever had that got me to where I'm at today and my mindset, is Aaron Robles. He's the physical therapist out of Jacksonville, Florida. And I'll never forget it. I thought I was a really good physical therapist when I moved from Destin to Jacksonville, and I ultimately forced him to hire me too. True stories. I forced both of my bosses to hire me strategically, obviously. So, anyways, I'm working with Aaron and he's mentoring me. He's coaching me on functional mobilization, functional manual therapy, which was a whole new world for me at the time. And I'll never forget it. We were working with a patient who had a shoulder issue, and he's taken this patient through these ranges of motion. And then he finished and he asked them to stand up and move your shoulder around. How's it feel? And they go, it hurts. And he says, I don't care that it hurts. How does it feel? And they just said, well, it still hurts. And he goes, yeah, but you're moving it so much better. How does that feel? And they just kept fixating on the pain. And he finally said, let's call him Bob. Bob, I don't care about your pain. Look at how much better your shoulder is moving. And that just blew my mind because traditional physical therapy is focused 100% on the pain, 100% on the symptoms. Your back hurts, do these stretches and exercises. How's your back feel now? Well, it feels better. Okay, so I guess that worked. Aaron taught me that it has nothing to do or minimal to do with the pain itself and maximal to do with what the body was telling you. So that led me down the same road of adopting it, saying, I don't care about your pain because this has been true in 100% of the cases that I worked with over my career. As function goes up, pain goes down. It's never not been true in my whole entire career. Knock on wood, hopefully I don't run into that one person that proves this theory wrong, or because, yeah, technically it is a theory. But if we just focus on function, if we just get your body functioning better, more efficient, more responsive, stronger, more stabilized, the pain will go down. And here's the kicker that's so hard for people to understand is it's almost always delayed, meaning that, yes, I'm stronger, but the pain's still there, so I must be doing something wrong. That's not true. You just have to keep doing it right, and ultimately, eventually, the pain will start going down. And that's when we started getting the results that we get that are secondary to nobody in this town because people are telling me, like my clients are telling me, I call them clients, not patients, just because it's a different relationship where I'm actually listening to them. They've been through the run of the mill, they've been through the cookie cutter approach to physical therapy, and that's what I call it. And it's not a derogatory thing, it's 100% geared on insurance. So it all comes back to insurance. Insurance will only reimburse for medical services that they deem medically necessary. That very rarely is what is in your best interest as the patient. So at the cookie cutter R Us physical therapy clinic, almost everywhere in this town, they take insurance and they can only do interventions that they will get reimbursed for, or that's a bad business model. Problem is, those interventions are geared towards symptoms and not the actual problem. So that's when I decided, okay, I know I don't care about your pain, I care about your function. And I damn sure know that I don't care about what the insurance company thinks is medically necessary because it is rarely ever what is actual really necessary for you, the patient.
Mhm.
So no insurance, and I'm going to focus on your function, and we're going to get astronomically better results than anybody else in this town. So that's how we got to where we're at.
Yeah, probably anybody else in the whole country. I'm willing to bet. Because no, I mean, I'm sure there are probably other practices like yours, but they are sure few and far between. In fact, up in Connecticut, where I have my other magazine, and we have a ton of holistic and integrative and all different types of alternative practices, but I don't know anybody in physical therapy who's doing what you're doing. So it's just interesting to kind of extrapolate that across the country. I bet there's very few people.
Yeah.
Um, I want to get back to the pain thing because there was something that you said that kind of like triggered something about just people's response to pain and their focus on it, almost like an addiction to it. Because I was just working with another person who's advertising in my Connecticut magazine, and she is a life coach, but she specifically works. One of the things that she does is specifically works with people who have chronic pain, all different kinds. And her technique is basically shifting their mindset around it and trying to change the neurological patterns. Because she was telling me that people can become so addicted to being in pain, which sounds crazy. Like, why would you want to? How is it possible you can be addicted to being in pain? But because you keep noticing it, you get into this neural pathway. Like you're forming a new neural pathway where your body is more responsive to pain. And like you said, when you were working with a particular client, like, oh, he was so focused on the fact that it still hurt, he wasn't even noticing his range of motion had drastically increased, right? Because we're like fixated on that pain pathway, I guess it is. So I think you're doing the same thing, just in a different way in terms of what you do with physical therapy. You're trying to pull people out of that addiction to their pain pathway.
You're hitting the nail on the head, and this is one of the strategic things that I do without you really knowing that I'm doing it in the clinic is I do an equivocal sign. An equivocal sign is let's look at something pre-treatment and then do an intervention and look at that same something post-treatment. And that will let me know that, yes, my intervention was successful. So, one of the easiest ones for the listeners to think about is if you have back pain, pre-treatment, can you bend over and touch your toes? And some of the things that I'm looking at is not necessarily the totality of the movement as much as the quality of the movement. Yes, you got down to touch your toes, but you were so guarded and it was so rigid and jagged, like that. I'm like, okay, that's my assessment right there. Did that hurt? Yeah, I mean, I feel it. That was not comfortable at all. So then I go and I do my assess or my intervention, and I'll have them move again, and I can see how smooth the motion is. It's not guarded, it's not apprehensive. It's just, I just bent straight down and touched my toes. And I'll say, wow, you're moving so much better. That feels better, doesn't it? And they're going, I think it still hurts. I'm like, I don't really care that it hurts because look at how much better. Wow, you're moving so much better. And they're like, wow, I think you're right. It is moving better. And it's this little trick that the brain has. It starts playing on you. That motion has hurt for so long that I didn't even realize that it doesn't hurt anymore. Like it's just this memory of it hurting. Then it's like, oh wait, it doesn't hurt. And I know it doesn't hurt because if it did hurt, your body wouldn't let you do it as smoothly as you just did it.
Yeah. So it's so fascinating just the way the brain works and all of this. It makes total sense to me when you think about how you just, illustrated that. What about people who think back pain is genetic? Is that true?
Oh my goodness. Less than 1%. I mean,
Okay.
don't hold me to that stat.
Yeah.
Based off of my entire career, the thousands and thousands of people that I've worked with over the years, I've seen everything you could possibly imagine. I've seen some really messed up X-rays and MRIs. And yes, there are some genetic things that occur that, okay, those are the cards you were dealt. What I can tell you is that if you're going to use genetics as an excuse, then you've given up. Because what does it matter? Who cares if you were born with it? What are you going to do about it? You can still address XYZ that you're in control of. And I'm telling you, I don't care genetics or not, you got back pain, at least one of your glutes is not doing its job. And most likely one of your obliques is not doing its job too. So focus on the things that you can control because you can't control genetics. But again, it's less than 1%. I mean, it's not even significant enough to mention it.
Yeah, I think that's another thing that people just get in their heads and like, it's about a mindset, right? Like you witnessed something when you were growing up, some issue or disease or whatever that one of your parents had, or a relative, or someone close in your life, and that related to you. And now you kind of have this idea that, oh, because my dad had that, I'm going to have it, or my mother had that, so I'm going to have it. And it's just amazing that people get into these thought patterns of, I that's the be all and end all. Like, that's my path laid out for me. I have no control. It's genetic. It's in the family. I'm going to have it. When you not just back pain, you can look at a number of different diseases. There's even been studies with identical twins that show one twin gets a particular disease and one twin doesn't. If that isn't like the epitome of proving that genetics means nothing, really, I mean, I don't know what else is. So I'm glad you answered that question. That was awesome. We're going to be talking about a lot more. You've got some tips for us that I'm excited about in terms of how you teach people to eliminate chronic back pain and all that. But we're going to take a short break right now. When we come back, we'll be talking more with Dr. Jake Berman. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden, and I am talking today with Dr. Jake Berman. His website is www.bermanpt.com. That's BERMANPT.com. And so before we left, we were just talking about genetics and, people's mindsets around everything from thinking they're going to get something that's genetic in their family to just, how they deal with pain, the fact that people can actually become addicted to pain. Um, I along the same lines of like the mindset thing, I think that people still have this idea that, well, I'm eventually going to have surgery, or I'm eventually going to always have to be on like a medication or, pain medicine or something like that. And that's just not the case. Like, I know you're going to tell us, what can be done without taking pills and why surgery isn't always the answer. So, um, let's talk about medicine. What can be done without having to take pain medication forever?
Holy cow. How many hours do we have to talk about this?
Not enough.
Oh my goodness. Let's go down this other road that my wife's in right now where the internal inflammatory response. So many times we have back pain and we're just focusing on this pharmaceutical, this chemically composed drug that was made in a lab somewhere, completely synthetic and fake. Who knows what's really in it to take the pain away? But what we don't really look at is how much inflammation is occurring because of the state of the body. And we could talk about hours on this, and I'm sure that you can and have talked about hours, but this is one of the specialties my wife has is healing the gut from the inside because so much body inflammation occurs with the foods that we're eating, the water that we're not drinking. So that's one major thing. Okay, you got a bad back. I can't tell you how many 65 to 75-year-old male golfers that I've worked with who have bad backs that are drinking 3 glasses of water a day, 6 cups of coffee a day. Don't forget about the toddies at the end of the night, right? But they got their 3 glasses of water in, and I'm going, no wonder you have back pain. It's like your engine, you get the engine in your car, there's no oil in it. How are you supposed to lubricate the rods and pistons? I mean, of course it's going to explode. So there's another simple thing is making sure you're getting enough water in. And the thing that we've got to remember is when you're taking a pharmaceutical, that is 100% focused on treating symptoms and not problems. 100%. You cannot argue that a pharmaceutical medication given or taken for back pain is not 100% focused on treating the symptoms because if it weren't, then you wouldn't be reliant on it. You'd be able to take it for X amount of time and you'd be done. So things that you can do to get off of it, I'm trying to get back to the original question. What are some things that you can do to avoid surgery? Is that the ultimate goal?
Yeah, yeah, exactly. So, one quick point I want to make, I think it's important for people to catch what you just said, is that when we think about pain, I think we're thinking about, okay, what exercises can I do? Maybe massage might help, or I have to take pain medicine. The fact that you brought up that most people are chronically dehydrated is something I bet most people don't even think about. Like how drinking enough water can help with pain. Like we just don't, I don't think our mind goes to that. And your diet and nutrition and having critical vitamins and minerals that you need. And all those things that contribute to inflammation. I think we're thinking more like not what we're putting in our body, but what can we do on our body, massage or ice pack or heat pack or something like that. But it's so important with water and nutrition. I want people to realize that makes a huge difference. So those are some things to do so that you don't have to take pain medicine. Why is surgery not always the answer? I think we touched on this a little bit before. You explained like what the orthopedic surgeons typically do and kind of how you move. You have to move from one surgery to the next to the next. I would say that's a big one, is why it's not always the answer. But what else? Why else would that not be the choice somebody should make?
I love this. Great, great question. And again, fifth grade reading level, that's really dumbed this thing down. One of the easiest ways that I can recommend, or not, sorry, one of the easiest ways that I can suggest that surgery is avoidable or inevitable is, can you find a position of relief? Meaning that my back hurts when I'm standing. When I lay flat on the ground, my back doesn't hurt. I'm like, okay, so there's literally no change in theory in your spine. It's straight when you're standing and it's straight when you're laying on your back. The only difference is gravity. The only thing in your body that was built and designed to fight gravity long term is muscles. So if you have pain standing, but you don't have pain laying down flat on the ground, it is highly unlikely that you need to have surgery. It's highly likely that you've got to work on some stability to stabilize and give you your spine support when it's fighting gravity. So now let's take that same person. I just can't get relief. I tried cookie cutter physical therapy. I've tried injections. I've tried all this stuff, and my MRI keeps saying L4-5, blah, 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 blah. Gotta have surgery. Okay, go have surgery. I can almost guarantee you within 5 years max, something else is the reason why L4-5 was having a problem to begin with. So I want to be really clear on this because I don't want people thinking that I think I'm the holy messiah or Superman or God or whatever, and I can just put my hands on back pain and heal it. That's not the case. There have been many people over the years where I'm working with you and I'm going, I can't find a position of relief, or this thing is so messed up that the return on investment is not there. I just had one of these people, this lady, she's absolutely amazing. Just had her in here just this past season, and she had a lateral shift. So her hips were going one way, her spine's going the other way, and she's older. She was in her late 70s, and I'm going, we could spend time really trying to strengthen all of these muscles to keep this shift from really flaring her up with standing and walking on the beach. But it wasn't worth the um, the time that it was going to take. In reality, it was going to take her 18 months. I mean, it really was going to take her 18 months to get the muscles to be that strong to where she could have done the things that she wanted to do. And I'm going, all things considered, I don't think it's worth it. Just have the surgery, and within 6 months, you're doing everything that you want to do, not 18 months, and it's more guaranteed than not. So there are cases where I'll say, you know what, this is not worth the return on investment of your time, the energy, the heartache to try to avoid surgery. Just have it, and then let's move forward. But it's so rare. It's so uncommon in the general population because most people, how should I say this? 95% of people, a minimum of 95% of people who have back surgery have that back surgery primarily based off of what their x-ray or MRI says. They might have went to a physical therapist, most likely was in network, and probably didn't get the same attention that they would have gotten if they came to me. Because I don't take insurance, because when you walk in the door, you're the only one that I'm focusing on. I can take the time and put my hands on you and test every single thing that I want to test. I can say, all right, this is what is happening. This is what's not happening. It's really likely we can avoid the scalpel. So I know that there's going to be people listening to this that are pissed off and they're saying, well, I had to have surgery. I'm that 1% or whatever it is. I'm like, okay, if that's what you want to tell yourself, you live your life, I'll live mine.
Yeah. I don't think it's you were saying earlier, like I don't want people to think I'm like a miracle worker on the back or whatever. I don't think it's that at all. I mean, the way that you explain it to me makes absolute perfect sense. I think people just have never thought about it from that perspective. Like obviously, if you can be pain free and in the same, you know, have your spine in the same situation like you're explaining, standing versus laying down, then there has to be some way to fix that that doesn't necessarily require surgery, right? And it's about figuring out, well, what are the mechanics of the body and how do we, how can we figure out what has broken down, let's say, to build it back up versus okay, the person has pain in this area, we're just gonna fix it by going just surgery. Sure, you could fix it like you said for a short period of time, and then because the root cause wasn't fixed, guess what, another problem's going to pop up somewhere else. That makes perfect sense.
I love it. And you said one thing there that I think is really important to note is I don't want people thinking that I'm a magician, I'm a miracle worker. And for complete transparency, I'm not doing the hard work. You're doing the hard work. I'm just finding the problem that needs work. Then it's up to you to do the work. So if you're not willing to put in the work, don't come to me. I'm not going to get rid of your pain. I will show you how to get rid of your pain. I'm like Mr. Miyagi. You got to be the Karate Kid. I'm not going to be out there painting the fence. You're painting the fence. If you want to win the tournament, you're painting the fence.
Yeah, that's funny. I mean, that is a whole nother thing that we didn't even talk about really. Is basically like, the type of person, right? Like you have to be the person who is going to be willing to put that in. It's not, like you said it, you're not the one who's doing all the work. You're identifying, okay, here's what you need to do to strengthen these areas. Now you have to go do those exercises and build those muscles up and build that strength back up. And there's a lot of, I mean, sadly, there's a lot of people who just don't want to do that.
And that's okay. Don't come
Yeah,
see me.
right. That's okay. Then, go to the orthopedic surgeon because I don't know, some people might look at that as easier. Me, I'm like, I'm the person that will avoid surgery at all costs. So this is awesome. We're going to take a short break, and when we come back, we'll be discussing more about chronic back pain and alleviating that. I'm talking with Dr. Jake Berman. Stay tuned. We will be right back. We're back on the Dr. Diane show with me, Dr. Diane Hayden. You can learn more about me at www.drdianehayden.com. And I'm talking today with Dr. Jake Berman. His website is www.bermanpt.com. That's spelled BERMANPT.com. So I love this next question because I think you're going to have some fascinating answers to it. But what are other options that your doctor hasn't told you about to help with back pain?
Absolutely love this, and, um, lately, I've been getting really explicit, especially on our own podcast with my wife and I do on every Monday, and she's always trying to pull back the reins on me. I just can't help it because this Western medicine, this whole corporate medical system has just gotten so out of whack. And here's one thing that I've been saying a lot lately, and I'll bring it back to the question here in a second. So my car broke down the other day and I took it to the boat mechanic.
What?
Exactly. If you're watching this, you saw what her head just did. It kinda just went sideways, like my dog looks at me going, did you just speak Spanish to me? I barely speak English, but you just spoke Spanish to me?"
Right.
My car broke down, but I just took it to the boat mechanic to get their opinion on it. That's exactly what we humans are doing. You have to understand who you are getting advice from. An orthopedic surgeon is an expert at performing surgery. They are not an expert at helping you avoid surgery. They are not an expert at helping you recover from surgery. Physical therapists should be experts at helping you avoid surgery and should be experts at helping you recover from surgery. Primary care physicians, this is a great one. And I can say this because my wife went through the physician assistant program, and it was an internal joke where primary care physicians are experts at referring out. They're experts at that. Refer to GI, refer to ortho, refer to neuro. You're just an expert at referring out. You're usually not treating things, you're experts at referring out. So the running joke in my wife's class was whenever it was time for the primary care test, the answer was always refer out, refer out. So I say all this to give you background and context that you'd never take your car to a boat mechanic, even though they're both motors, they both work on motors, but the boat mechanic specializes in boat motors. The orthopedic surgeon specializes in surgery. So if you're trying to avoid surgery, maybe, just maybe, you shouldn't be going to the orthopedic surgeon first, right? Maybe you should be going to a qualified physical therapist that might actually have the time to give you a fair assessment and see what's going on. That's why I said physical therapists should be experts in helping you avoid surgery. If you're going to the cookie cutters that are in network that are seeing 3 to 4 patients an hour, there's no way they have the time to give you a really valiant effort at avoiding surgery. It's just not possible. I used to do it. So I
Yeah.
can say this, you just can't do it. There's just too much juggling around. It's not possible. So to come back to the original question, what are some of the things that your doctors aren't telling you? The first thing you got to remember is, who are you listening to? Which doctor are you listening to? And don't get me wrong, I say this explicitly on and vlogs and YouTube everywhere. Don't even take my word. If you don't like what I'm saying, question it. If you don't like what the orthopedic surgeon's saying, question it. Keep questioning it and keep asking somebody until you finally get an answer where you're like, I like that answer. I'm going to go all in on that one and go down that road. Because, like you said before the break, some people might want to have surgery. Some people might not want to put in the work, and that is fine. Go do it. Just make sure that you're not doing something. This is the most important thing on this topic, in my opinion, is just make sure you're not doing something just because the doctor said to do it.
Mhm.
Question the doctor, question Jake, question the orthopedic surgeon, question the primary care. Remember, primary cares are experts at referring out. So maybe you shouldn't be taking their advice hook, line, and sinker when they're talking to you about your back pain. Orthopedic surgeons are expert at doing surgeries. Maybe you shouldn't be taking their advice when they're trying to give you advice on how to avoid surgery, injections and pain pills, right?
Right.
Just listen to it. Me, if I'm telling you to have surgery, or actually, let me be careful about this. If I'm telling you exactly how we're going to do surgery, you better be running. Don't get me wrong. I refer to surgery whenever is necessary. So again, no God complex. I'm not going to try to heal everybody. I will not waste your time or your money. If I'm not getting the results, you need to go consult with ortho because this is outside of my scope of practice now. So I think that that's one of the biggest things that you've got to remember. What are the doctors not telling you? You got to know which doctor you're talking to before you can question what it is that they might not be telling you. Was that a clear enough, vague answer for you?
No, no, no. But I mean, it makes perfect sense, right? It's, everybody thinks, well, you're a doctor, so you should know everything about whatever it is we're talking about. And that's not the case. Yeah, you made a great point. Surgeons know about surgery. That's what their expertise is. But they're really not, you know, they're not there to help you prevent surgery or, what to do after surgery. So I think, yeah, I think it's a great point just to get people to start thinking about, yeah, like who's giving me advice and does it feel right for me or not?
Who's giving me advice, but more importantly, whose advice am I listening to?
Yep, exactly. Yep. So, what are three things someone could do tonight to ease their back pain?
One of the first things is a psychological thing, which is the thing that I've been saying for years now is herniated discs do not cause back pain. Bulging discs do not cause back pain. And there's been multiple studies. I don't know if we talked about it on this episode or not. It's starting to blur together now. 60% of the people over the age of 40 who have zero pain at all have some type of herniated disc, bulging disc, degenerated disc on their MRI. So just
Wow.
because you have one doesn't mean that that's what's causing your pain. So that should give you some comfort tonight. That's number one. Number two is find somebody that specializes in helping you avoid surgery. It's literally on giant wall words on the front of my office. Right when you walk into my office, you look up on the wall and it says, avoid surgery and pain pills. That should feel good to you. Okay, this is what these guys do. They help you avoid surgery and pain pills. When you walk into the other cookie cutter PTs and it says core values, integrity, customer service, and timeliness, I don't know that I'm in the right place anymore. And the third thing is think simple. Fifth grade reading level. One of the easiest things that you can do to start alleviating back pain right here, right now, today, tonight, is squeeze your ass. Wake your ass up. Stand up real tall, chest up tall, pull your belly button in real tight, clench your glutes as hard as you possibly can, straighten those knees so you can clench them even harder. The harder you get your glutes firing, the less stress you're going to have on your back. Those are, again, that's superficial. Individual results may vary. So there's three things right out of the gate that should help now.
Yeah. So I love it. So the first one, mindset, that's my thing. I'm all over that. Like we talked a lot about that in terms of just getting people out of the thinking about it all the time, right? Like meditation would be huge for people, I think, to help with just rewiring, neural pathways, but also getting you out of thinking about being in pain all the time. So I love that. I love the one about the glutes. What about if you're sitting all the time? Can you just sit in a chair like we're doing and just squeeze them? Or you prefer people stand to do that?
You have to stand. It's
Okay,
so hard. I mean, because in the seated position, your hips are generally at a 90-degree angle, and you generally don't have the most pain in this position. Again, sciatica and all these other things are different. But what I'm
right.
trying to say is, I've never, ever helped somebody resolve their back pain by strengthening their glutes in a 90 position, 90-90 position.
Yeah.
So if you're sitting all day, every 20 minutes, stand up and do exactly what I just said 3 minutes ago, squeezing your glutes as hard as you can for 20 seconds and sit back down. Every 20 minutes, stand up for 20 seconds and sit back down, squeezing your glutes, doing exactly how I described it. If you just do that, I mean, if you don't have 20 seconds 3 times an hour to get rid of your back pain, then you definitely better not be calling me.
Exactly. And speaking of that, do you do consults for people?
Yes, we do
Okay.
in-house and virtual. Since the whole COVID world, we've mastered virtual. So nationally and internationally, really gotten really good at helping you figure things out through the computer screen. And then in-house, we are taking new customers too. But there is you have to be qualified. Again, I take
Sure.
this very seriously. So I take all first phone calls and I want to make sure that you're really into this thing because I'm not going to waste my time and I don't want to waste your time or your money. So we get that out of the gate right out of with the first phone call.
I love it. Well, thank you so much, Dr. Jake. This has been awesome. Again, people can find you at www.bermanpt.com. It's been an awesome chat with you as always. And I want to thank all of you for tuning into the Dr. Diane Show. Please join me the first and third Thursdays at 11 a.m. Eastern and 8 a.m. Pacific. Have a great week, and I will see you back here next time.
Yeah.
Thank you for tuning into the Dr. Diane Show, revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. Tune in every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on transformationtalkradio.com. Center your thoughts on what you want and shut the door on every suggestion of fear, worry, or lack from your own consciousness or the consciousness around you. Once you master that, everything is possible. To learn more about me, Dr. Diane, and receive a free digital subscription of my magazine, visit naturalnutmeg.com.